can we say, based on what you know, is it fair to say that the second wave has begun?
It's hard to speculate because we still have time to actually keep these numbers under control if we all work together as governments and as individuals, Canadian individuals. But listen, we can't rule that out. We can't rule out that we could continue to see these numbers rise across the country, and that is the real risk of COVID-19, is that it takes constant vigilance to keep it down.
So as a government, what will you do as a government to prevent exactly that scenario?
So that's the work that we've been doing over the summer, is to prepare our country for the potential of a second wave or for these outbreaks that we're seeing in various regions. Part of the work has been to create, for example, a rapid response system. So we have a number of tools federally that we can sweep in to various regions to help put out the flames of COVID, if you will. So for example, I'm working right now with Peel Public Health and the mayors in that region to figure out what tools they need to actually bring those numbers down. It might be things like isolation housing, like I announced in Toronto. It could also be things like expert epidemiologists, additional contact tracing capacity that we've built up at Statistics Canada in a variety of languages, and a number of other tools. And so each region has different kind of strengths and weaknesses, and our job at the federal level is to make sure that we can backstop what the work that they're doing.
How much fatigue is there, or how much worry is there about COVID-19 fatigue?
I'm very worried about that because I believe that's part of what's driving the increase. Two things, really. One, it's getting cold out, so it's harder to gather outside, and we know that. I mean, I come from Northern Ontario. We spent a very lovely summer gathering on decks if we had to, outdoors, backyard barbecues, which obviously is safer. You're outdoors, you can space out more. So as people move inside and start to gather in small gatherings, family gatherings, intimate gatherings in their household, that's where the risk increases. And I think people are tired of being apart. I spoke about this last week. It's exhausting to be apart from the people that you love, to be apart from your family and your friends, and the challenge is we have to keep it up.
Yesterday you spoke about a more targeted regional approach to a lockdown, but I'm wondering if there are other ways that it can be done differently this time. For example, would there be a more targeted economic approach where some industries are shut down while others are allowed to remain open? What other specific changes might Canadians see?
Absolutely great question, because it doesn't have to mean that everybody has to stay home and not go to work. It could be that if the public health unit identifies that growth is happening, for example, in a specific sector, or if there's a particular large employer that's having an outbreak, that's some of the ways that you can actually bring down those outbreaks. And I point to Windsor Essex, who has done a really good job over the summer bringing their numbers down. Still lots of burbling there, but not in the level that it was the early summer as the temporary foreign worker outbreak was really growing. And in fact, it wasn't an entire, shutdown. It was really working with those particular farms, and actually Public Health Agency of Canada was there in that very way I described earlier. Well, I'll just say that it's a global pandemic, and we don't have to look very far to see countries that have lost control of their pandemic and are in serious condition, both from a health perspective and an economic perspective. In fact, the health of Canada depends on all of us taking this seriously, but the economy of Canada depends on that as well, and those things go hand in hand. We'll obviously work with our partners to communicate with Canadians and guide them to accurate sources of information. I know that part of the pandemic challenge, and I think part of the challenge of our time, is the volume of misinformation that's out there. And so we constantly are out there communicating with Canadians with reliable information that's coming from the Public Health Agency of Canada and our experts. What I'll say is all governments are taking this seriously, and they have a blend of tools. We do have something called the Special Advisory Committee. All the provincial public health officers meet together to talk about their own situation and to share ideas and tools, because I think we all are in a space where we recognize the best way now forward, that we've managed to flatten the curve, and yes, we see those numbers rising, but a full economic shutdown would be very difficult for this country. Not to rule it out, because of course, listen, we will protect the health of Canadians and we will do what it takes, but I think we've learned a lot since the first wave, and we've made some significant improvements in the healthcare system, in our preparedness in terms of equipment and supplies, and even understanding of the virus that will allow us to manage this next stage.